Good afternoon. My name is Vishal Sunwar, and the title of my presentation is Roles and Responsibility of Registered Nurse. The objective of my presentation are the recent changes and their impact on the roles and responsibility of the registered nurse, the role of the Nursing and Midwifery Council in relation to nursing practice, the implication of the code on nursing practice and the role of the registered nurse, the need for effective communication in a multidisciplinary healthcare setting, and lastly, the evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting. The recent changes and their impact on the role and responsibility of registered nurse. The history of nursing. Historically, nursing was considered as a practice to help sick and dying people get better. Nurses would normally assist physicians to care for patients, which includes helping with eating, hygiene, etc. There was no formal qualification for nurses, and the nurses' duties were mostly performed by the nuns or the people from the military. Nightingale and modern nursing. Florence Nightingale is considered as the mother of modern nursing. During the war, after observation many dying people in the hospital, Nightingale worked to improve on sanitization and patient care in the hospital. She opened the first nursing school called the Nightingale School for Nurses in 1860s. Today's St. Thomas Hospital in London. Nursing today. Today's nursing has changed with the new nursing technology and the medical advance, but the core of the nursing to help people remains the same. To be registered nurse, we must complete a nursing degree program leading to registration with the Nursing and Midwifery Council, NMC. Registered nurse provide a personal-centered care that is based on research and evidence for the service user. Nurses can choose the area they would like to practice and tailor their education to that field. For example, emergencies, cardiology, and pediatrics, etc. At the heart of nursing, there are big six C's. They are care, compassion, communication, commitment, competence, and courage. The recent changes in nursing includes, in 1916, Royal College of Nursing was founded with 34 members as shown in bottom right. In 1983, new professional register with 4 branches were set up for 4 fields of nursing: the adult, children, child, learning disability, and the mental health. In 1986, Project 2000 was set out to move from hospital-based school to diploma-level college and university-based nursing training. In 2002, nurses were able to prescribe medication. In 2004, RCN voted for degree-only program for nursing profession. In 2009, all nursing courses in UK became degree level. In addition, as you can see on the bottom, there are various ways to become a registered nurse. For example, the first nursing degree apprenticeship was available from September 2017. This apprenticeship program is funded by the workplace and students can complete a nursing training while being on a job. BSc Adult Nursing 3 years degree. BSc Honors Nursing, whereas Flexible Learning is a part-time nursing degree for 4 years to become a qualified nurse. And lastly, postgraduate diploma nursing is a 2-year nursing degree for the graduate students. The modernization of the NHS in the past 20 years have resulted in changes to the way of thinking about the nursing professional. The change in demand with complex and contrast-changing needs of patients needed the advanced skill to meet the capacity. The emergence of the role of the advanced nursing practitioner have provided the patient to receive timely care. ANPs can independently prescribe appropriate medication, evaluate, or refer to other specialists when necessary. The recent change due to global pandemic COVID-19 has a huge impact on everyone. The nursing professional has been one of the most impacted by the changes, the devastation and the exposure to the disease. Nurses were constantly working in front line to fight the pandemic and support the patients suffering from coronavirus. However, every nurse has been impacted by pandemic differently due to strain amplified by staffing shortage and burnout. Likewise, during recent NHS pay ballot result, the majority of NHS employers across the UK voted to strike. Due to the unmet demand of the NMC for the pay rise of the nursing professional, there was an NHS pay ballot. The overall result from the ballot shows that the majority of NHS employers across the UK have voted to take strike against action in their fight to fair pay and safe staffing. The role of Nursing and Midwifery Council in relation to nursing practice. What is NMC? It is the UK's professional regulator for nurses and midwifery in UK and nursing associates in England. NMC was established in 2002. It sets the standard of education, training, practice, and conduct for nurses and midwives in the UK. And its purpose is to keep the public safe by ensuring that registered nurse and midwife are qualified, have the right skills and behave in a way that meets the standards expected of them. NMC values diversity of people on the register to ensure the fair process and accessibility to all. The aim of the NMC is to protect patients by improving nursing practice and raising standards through a system of professional regulation. The role of NMC is to protect the public by making sure all nurses and midwives are safe to practice with up-to-date knowledge and meet the standards set out in the code. The NMC is responsible for setting standards in the UK to make sure all nurses and midwives are safe with the right knowledge, skills, and attitude. Nursing and Midwifery Council Revalidation. Nursing and Midwife Council Revalidation is the process of keeping all nurses up to date with relevant skills and knowledge during their career. It ensures the practitioner is licensed practice. This also includes ensuring they are informed about new evidence, changes in practice, and legislation that affect the care patients receive. All nurses must submit revalidation every 3 years. If they don't meet current standards, they can be removed from the register or have restrictions set for their practice. Analysis the implication of the code on nursing practice and the role of the registered nurse. The code is a professional standards that all the nurses, midwife, and nursing associates must uphold to be registered to practice in the UK. NMC, in line with the code, acts if any concerns are raised about whether a nurse or midwife is fit to practice. Nurses uphold the code within the limits of their competence. For example, while a nurse and a nursing associate play a different role in an aspect of care, they will both uphold the standards in the code within the contribution they make to overall care. The professional commitment to work within one's competence is a key underpinning principle of the code. The implication of the code should be useful for everyone who cares about good nursing and midwifery. For example, service user can use code to provide feedback to nurses about the care they receive. Nurses can use code to promote safe and effective practice at work. nurse organizations should support their staff in upholding the standards in their professional code as a part providing the quality and safety expected by safety users and regulators. Nursing educators use code to help students understand what is meant by a registered nurse and how keeping to the code helps to achieve that. The researchers have shown that the skilled nurses are treating many patients and working extended hours without the adequate break and therefore could not remember the accurate information when updating the patient record. In the NMC Code of Conduct, it is a requirement for nurses to perform their duties and maintain accurate record. Keeping of their intervention and the Care Quality Commission, the nurses train their capabilities and standards by the code through different trainings such as e-learning and seminars. In conclusion, for the registered professional in the NMC, the code is seen as a way of reinforcing professionalism. The nurse provide the evidence of their continued ability to practice safely and effectively through revalidation. The needs for effective communication in a multidisciplinary healthcare settings. What is effective communication? It is a process of exchanging ideas, thoughts, opinions, and knowledge so that the message is received and understood with clarity and purpose is known as effective communication. Having a good communication skill is essential to provide a patient-centered care in nursing. In healthcare, poor communication skill can lead to misunderstanding, failure to follow treatment resulting in a medical error and poor patient care. Communication in healthcare setting can be divided into two parts: inter-hospital communication and intra-hospital communication. Inter-hospital communication includes sharing communication among MDT and exchange of information and the resources between them, for example, while transferring the patient from one facility to another, transferring medical files and moving vital medical equipment, etc. Whereas intra-hospital communication includes the communication among the personnel within the same care setting. This type of communication occurs within a single institution, for example, communication involved in the coordinating room changes and setting up surgeries, scheduling appointments, etc. Poor communication could reduce the efficiency of each process or even danger to the patient. The needs of effective communication skill among MDT in healthcare setting for various reasons, such as to understand the patient, condition and their needs as doctor, nurse and other healthcare professional provides patient with care from the start to the end of their treatment. These professionals work to assess, understand and evaluate patient condition. Hence, the effective communication is very important, for example, while taking patient from family background, medical history, lifestyle and many more. To understand the emotional state of patient, the quality of the interaction with them is very important. It can impact on how well we understand patient and their well-being. Understanding patient of different age and gender. As healthcare professional, we come across different patient age group. With effective communication, we can interact with patients of different age group, for example, children, teenager, and elderly patient. Effective communication could help us understand the social determinants which may also have positive impact on patient overall health and well-being. Creating synergy. There are many doctor, nurse and other employees in the hospital dedicating themselves to wellness of the patient. For this purpose, effective communication between MDT is essential. For example, nurses must report the patient health condition from time to time to doctors. Likewise, doctors instruct nurses on how to manage patient condition. So effective communication is indispensable for creating synergy in healthcare setting. Identifying specialized needs of the patient outside their medical care is very important. For example, some patients may have religious belief or specialized dietary needs. Some people may have difficulties to communicate to different language barrier, limited literacy, hearing impairment, etc. Likewise, the information will ensure the quality of care is not compromised and patient requirements are met properly. NHS England focused to promote health information in various languages and provide services as interpreter for those whose English is not a first language. Evaluating the effectiveness of the multidisciplinary approach in healthcare setting. In healthcare, alongside the clinical intervention, we need support from experts from various disciplines such as physician, nurse, social workers, pharmacists, and other specialists to improve healthcare outcomes and reduce potential error. The multidisciplinary approach in a healthcare setting consists of healthcare professional and allied disciplines working together to provide holistic, person-centered, and coordinated center. Benefits of multidisciplinary care approach. A holistic and integrated approach to care requires the coordination of multiple interventions, and MDT approach plays an important role in breaking down the barriers such as cultural and organizational differences. A success MDT approach can ensure significant benefits to the service user. As shown in this slide, joint assessment and care planning informed by service users' own decision. Effective communication and information sharing between the team and the services users. Great involvement of the service user of their families in the decision of their care. A single point of access through a key worker or named coordinator. Rapid access to specialist expertise in the community. Effectiveness in a multidisciplinary approach. The recent research based on evidence indicates the care provided by MDTs are especially suitable for people with complex health needs and long-term who benefit from holistic provisional. MDT approach, which is flexible, collaborate, and adaptable approach, which is effective for a whole range of including adult, children, elderly group. The benefit of multidisciplinary approach involves different healthcare professionals to provide appropriate care that can be more holistic. For example, after the hip replacement surgery by the surgeon, the patient are looked after by the nurse to manage pain and various support. Likewise, psychotherapists work with the patient on stretching and movement aid muscles and joint post-surgery. In the same way, occupational therapist aids with upper limb functioning tasks, including kitchen activities, etc. Limitation of multidisciplinary care approach. A shared vision, a shared vision and a clear goal, as shown in this slide. Short-term leadership followed by consistent working practices, access to shared resources, opportunity for reflective team learning, focusing on innovation and effective use and distribution of funds to commission service for MDT, specialized training and the professional development within the team, a good mixture of professionalism background and boundary spanning roles, involvement of service user in a care planning and decision making. In conclusion, as shown in this slide on the left hand side, despite of the limitation, there are several benefits of MDT's approach in a healthcare setting. When all the clinical therapists and other healthcare providers are involved in providing person-centered care, a holistic care can be delivered. MDT focuses on keeping well and independent, delivering right care in hospital, home, or community. Therefore, MDT approaches is essential in delivery of quality or care among service users. Thank you.